much. It's a great pleasure to be back in this room today and tonight. I remember coming here not too long ago when we were discussing about the healthcare debate in Washington, D.C., and we came here and talked about the healthcare legislation that was going through Congress. So it's good to be back in this room again. And Dr. Bookman, thank you for all that you've done. I've known Larry for a long time. Our children were good friends together, and so I appreciate your leadership with this association and what the Oklahoma County Medical Association does for the state of Oklahoma. I've worked with many of you in this room for over many years. Last 20 years I've been in office, and I appreciate the strong leadership that your organization provides to help the legislature, to help our communities, to educate our communities, to share information about the importance of the health indicators of our state, and to get people more involved. So thank you for what your community does and your society does. I got to make two important introductions. First of all, my husband Wade Christensen has joined me here today. My husband's important, but also equally important is Wade's son, my stepson, Dr. Blake Christensen, who is in his residency at Baptist Hospital, and also a member of your county society, and I'm very proud of him. And so, students, this is where you'll be real soon. Just hang in there. Hang in there. I know how that feels, trying to get that residency and to be a part of this great program. Well, I want to talk to you in two different parts on my comments tonight. First of all, sharing with you a little bit about the challenges and opportunities I see concerning Oklahoma, our citizens, our health, our future, and some of the problems that we need to address as it relates to state policy and even federal policy. And then I want to tell you why I'm running for governor and what I hope to do for the state of Oklahoma, and to share with you the Fallin plan. Now, first of all, let me just say that health care is not something new to me, or it's not something that I just all of a sudden took an interest in. When I was elected to the Oklahoma House of Representatives back in 1990, I actually won the National Legislator of the Year for health care reform from the American Legislative Council, which is a conservative group of legislators nationally, for my work on health care reform. And during that time, you might remember that Hillary Clinton was talking about changing her health care system, and I actually held town hall meetings all across the state of Oklahoma talking about free market-based health care reform and why I didn't think we should go to a government-run health care system. And out of that, and out of my work on working on legislation in the legislature, I actually wrote and passed the Small Business Health Insurance Reform Act. Back in those days, I authored medical IRA accounts and also risk pools for the uninsurable and supportability laws. So I was very active back in the early 90s on various healthcare reform issues and involved at that time. And it's funny how I've come full circle just now on the federal level and debating these same issues. So I've enjoyed working on healthcare issues, trying to improve access to healthcare, trying to lower healthcare costs, and certainly trying to address many of our healthcare issues in our state. I've worked with your medical association over many years on issues like tort reform. When I was lieutenant governor, there were many times we would have press conferences talking about various tort reform pieces of legislation, both under Governor Keating's time and also with the Republican legislators when Governor Henry was in office. And I frequently gave speeches across the state of Oklahoma talking about how we had to have a legal system that would prevent frivolous lawsuits, that would help lower medical malpractice insurance for your industry, and have worked over the many years with many of your doctors and trying to help shape better legislative policy as it relates to medical malpractice reform during those many years. In Congress, I, of course, have been in the heart and in the middle of the healthcare debate about in our nation for the healthcare system that was just recently passed. I had the opportunity to be on the floor of Congress speaking about healthcare reform, access to healthcare, lowering the cost of healthcare, and free market principles, and I believe we should be initiating in our nation. And I have to tell you that I hope that I have been a great leader for the state of Oklahoma as it relates to healthcare related issues. There is no doubt that our healthcare system cost too much. There are many families that don't have access to health care. There are many businesses that can't provide health care because of the cost of health care insurance premiums. There's also no doubt that there are many physicians and doctors in our system that have trouble paying for medical malpractice insurance, and that limits access to care and limits access to those who will see Medicare and Medicaid patients within our system, not to mention just changes that you see in rules and regulations with the Oklahoma Health Care Authority, and certainly with the doc fix and sustainable growth rate and discussions that we have in Washington, D.C. And so there are a lot of discussions I've been involved in on the federal level, state level, and certainly as a legislator. I will tell you that I was not a supporter of the new health care bill in Washington, D.C. I didn't vote for it. I personally believe in free market systems. I believe in doctors and patients being able to communicate and make the best decisions about what's best for their health. I'm very concerned about the debt and the deficit and the $1 trillion new health care bill and what it's going to cost our nation, and very concerned that it did not have any tort reform in the legislation itself, because we know that frivolous lawsuits and medical malpractice insurance costs are major drivers. I think it's about $65 billion cost to our nation for delivery in our healthcare system. And I frankly am concerned about the tax increases, the mandates that are in the Obama's healthcare legislation. And so I do not support that, because I do believe in free market-based healthcare reforms system. And I have to tell you that as a potential governor for the state of Oklahoma, I'm very concerned too about the unfunded mandates that are in that legislation as we expand Medicaid at a time when it's hard to find doctors that will see Medicaid and Medicare patients because of the low reimbursement rates that we have. And it's estimated it's going to cost the state of Oklahoma an extra $500 million over the next 10 years in unfunded mandates with that legislation. So I wanted you to know where I stand on that legislation. As far as Oklahoma, I have to tell you that it's very disappointing that Oklahoma ranks towards the bottom on so many healthcare indicators, whether it's obesity, whether it's cardiovascular disease, whether it is diabetes, whether it is smoking, whether it is cancer, even teen pregnancy adds to our healthcare costs. And we rank very low in many of those factors, but there are a lot of factors that cause Oklahoma to be ranked low. Our high poverty rate, certainly within our rural area, is a big indication of status of health many times, is poverty. Lack of investment in preventative care and health care, lower reimbursement rates, lower educational levels in some of our areas. Lack of transportation certainly is a factor in health care itself. Lack of rural doctors, the lack of primary care physicians, lack of nurses, and certainly the uninsured. So we do have a lot of challenges in the state of Oklahoma, and I want you to know as governor that providing for a system that will allow us to hopefully provide better access to care, that will improve upon the programs that we have in our state, whether it's preventative care programs, whether it's programs like Insure Oklahoma, making sure that sooner care works properly in our state, and working on just health outcomes will certainly be an important goal of mine, and something that I hope to continue to work on. And frankly, if I'm governor of the state of Oklahoma, I promise you that if the legislature sends me tort reform, and it's good tort reform, not tort reform light, and sends me workers' compensation reform, and it's true workers' compensation reform, and it makes a difference in lowering costs, I'll sign it as governor. And sometimes we haven't always had governors that will do that. So now, I want to tell you a little bit about what I want to do for you as governor of the state of Oklahoma and what my Fallin plan is. There's actually 4 different pillars to my Fallin plan. First of all, focus on jobs and opportunity and creating the very best business environment in the state of Oklahoma. And how we do that is by keeping our taxes low, by reforming our workers' compensation system and lowering the cost, by acting on more tort reform in the state of Oklahoma, by focusing on education, because you can't have the students that you need going into medical school if you don't have a quality education system that provides them with the educational skills that they need in reading and math and science, so we can develop the workforce that we need to have the jobs and create the good paying jobs in our state. Thirdly, and working on government reform. It's our taxpayer dollars, it's your dollars as businesses that pay taxes to provide for government. Government has to work for us. Government has to be smaller, smarter, more cost efficient. One of the first things I'll do is have a blue ribbon committee that will bring in some of our experts from the private sector to work with the state agencies to make them cost efficient and effective. And then the fourth pillar of my administration will be to stand up to Washington whenever Washington does things that will further decrease our success in the state as far as mandates, unfunded mandates, certainly taking over various systems and increasing taxes upon our businessmen and women. Those are the very basic pillars of my administration, and I'm looking forward to working with you as your governor to improve the quality of health care in the state of Oklahoma and make government work for you. Thank you very much.